Welcome to Resolve IBS and IBD Naturally. I'm Courtney Cowie, a nutrition therapy and functional diagnostic nutrition practitioner. If you are struggling with the symptoms of IBS or IBD and want to get to the root cause of your symptoms so you can take back your health through a whole person approach, this podcast is for you. Just a disclaimer that the information I'm presenting in this podcast is for educational purposes only and should not be taken as medical advice. You should always consult a qualified practitioner before making any changes to your health or medical regimen. That being said, let's get on with the show. Dr. Joseph Rosado, I'm so excited to have you on the podcast today. You're an expert in cannabis and its medical and health benefits, as well as ketamine therapy, both of which I think are super interesting and very useful topics for people struggling with IBS and IBD to explore. And as you know, that's the main audience that this podcast is kind of catering to. And I think there's a lot of value, of course, outside of gut health issues. However, I think there's a lot to these therapies that can often be misunderstood, or people maybe just don't have all of the information. And so what I would love to start by doing is just have you talk a little bit about, you can pick whether it's cannabis or the ketamine one, and just talk a little bit about your experience, kind of how you got into this field and why you feel these plant-based medicines hold so much value for physical healing.
Absolutely. So I am an atypical physician in that I learned about the endocannabinoid system and the cannabinoid receptors while in medical school, which, yes, exactly. Your face says it all.
Yeah.
Less than 10% of medical schools in the United States, and I would venture to say in the world, cover or discuss the endocannabinoid system. The majority do not. And so while in pharmacology class during the toxicology section of pharmacology, we were talking about, medications, what they call drugs. And so we started, of course, with cannabis because the perception is always, it's the gateway drug. So let's start with that one. And so they started with the cannabis. They talked about the endocannabinoid system. They talked about the cannabinoid receptors. And then immediately they went into the traditional, uh, jargon of, but it's a gateway drug and it's toxic and it leads to XYZ. Well,
Yeah.
that evening I went back to my home and I pulled out my textbook on the pharmacology Bible, Goodman and Gilman, and I went in and I looked up cannabis sativa. And when I looked it up, it talked about further details about the different cannabinoid receptors and certain benefits and some studies, etc. And something very interesting that was written there was that it was not physiological, it did not cause physiological dependence, it caused psychological dependence. And I
Mm.
thought, so it's not like the conventional medicines like narcotics, opiates, benzodiazepines, alcohol, cigarettes, etc., that when you stop using any of those medications, you go through withdrawals. You go through actual physical withdrawals, with the exception of alcohol, which isn't really a medicine, but the others that I mentioned are. Whereas cannabis, whether you smoke one or 20 cigarettes, or you stop using it right now, you're not going to go through that same type of withdrawal that your body is yearning and craving for that medication. And so,
Mhm.
but I put it in the back of my mind because it was just one more tool that I would eventually use because where I was studying medicine, it was not legal. Also, it was 1999. It had become medically legal in the United States in 1996 in California. So we're just talking 3 years post the decriminalization of cannabis for medical purposes in California. So again, it was still very new, very novel in the US. So I wasn't going to push the envelope. I just kept my mouth shut. But I always had that in the back of my mind. And then as time passed and things progressed, and in 2010, when medical cannabis became legal in the state of Arizona, one of my best friends reached out to me because the state of Arizona, similar to the state of Florida, the medical dispensaries have to have a medical director. And so
Mm.
one of my very best friends reached out to me and said, "Hey, you know, I'm interested in getting this started and I need a medical doctor to be my medical director. Would you be interested?" I'm like, say less. And so we started the conversation, but his wife decided not to pursue it because at the time her son and my twin daughters were 14 years of age, and she didn't feel comfortable in us starting a business that dealt with cannabis,
Oh,
where in her mind we had been teaching our children, you know, to abstain. Little
yeah.
did she know that I always encourage my daughters to use cannabis above tobacco any day of the week and
Right.
twice on Sunday. That was always my belief because I knew it to be medicine. I had already, you know, studied it. I learned about it, considerably. So we had to squash that. And then that was in let's see, the girls were born 96, yeah, 2010. And then fast forward to 2014, in the state of Florida, they started talking about the decriminalization of cannabis for medical purposes in the state. The individual that was funding the campaign, a very well-known attorney, not only here but in multiple states, John Morgan, was pushing and promoting that because of his personal history with cannabis with his dad and his brother. And so when I started seeing the commercials, I reached out to him and said, I'm a physician, I'm an advocate. How do I get involved?
Yeah.
Within 24 hours, I was speaking with the campaign manager. A week later, I was on the Bureau of Speakers, and that was it. We just took off. Now, unfortunately, the law did not pass in November of 2014, so we went back to the drawing board. But in 2016, close to 72% of the population voted yes
Mhm.
for the medical use of cannabis in the state of Florida. And in that time, it allowed me the opportunity to learn more, research more, understand more, and be able to be prepared for when it was legal. In August of 2016, I was the first in the greater Central Florida area to recommend medical cannabis to a 35-year-old female that had a brain tumor. And
Mm.
then 3 months later, I was the first in the state of Florida to recommend medical cannabis to a 15-year-old boy. So I was the first to recommend to a child in the state that was terminally ill. He had
Oh,
a stage 4, very aggressive cancer that had eaten out his jaw, his
oh,
cheekbone, his eyeball, his eye socket. He had to wear an eye patch. It had penetrated the skull and was into the brain. And so he had already gone to St. Jude's on multiple occasions, participated in a host of clinical trials. Unfortunately, none of them were of any benefit to him. And so as a result, they pretty much said, don't bring him here anymore. We have nothing for him. And
mhm.
at the time that I started working with him, he was already on hospice.
Oh,
And
wow.
um, but because the hospice company has a different rule for children as compared to adults, he was allowed to receive the medical cannabis.
Mm.
And as a result of having done so, we were able to cut his morphine dose by 50%. He was getting 16 milligrams of morphine every 4 to 6 hours. We were able to drop that to 8, and so now he was no longer sitting or laying in his hospital bed in his bedroom, drooling, looking at his crotch. He was
Mhm.
now able to be in the living room, engaging with his family, asking his mom to make him rice, beans, and meat.
Mhm.
Um, was the best man at his brother's wedding, danced with his sister at his brother's wedding. And yes, although he did transition the following year in February, the quality of life that he was able to experience and the opportunity that his family had to have the old juju back
Mhm.
was priceless. And so, you know, is it going to cure everybody? Is it going to treat everyone? Probably not. There are some people that use medical cannabis, and unfortunately, it does not work for them.
Mhm.
But you know what? There's hundreds of thousands, if not millions of people that have been on chemotherapy that's not worked for them either. So
Right.
it's not one size fits all, and not all medications work for everybody the same way every time. So
Yeah.
that's really a good take home message, that it's just like any other medicine. and we all have different experiences with it. And I have, like I mentioned earlier, I have twin daughters, and each one of them are genetically different. I've done genetic testing on both of them, and how one metabolizes medicine and how the other one metabolizes medicine are 180 degrees apart. So
Mhm.
if that's true of two individuals that shared 38, 39 weeks in a womb together, same mom and dad, and they respond and react differently, imagine the rest of the world, you know? So to
Oh yeah.
say that, oh, well, it didn't work for me, so I'm not going to do that. Okay, that's fine. But don't crap on it because somebody else is using it, you
Yeah.
know.
Absolutely. No, I agree with all of that, Joseph. And I feel like cancer, especially, is a pretty complex issue, right? Like, I mean, there's a lot of factors collectively that can drive that. And with the story about your twin daughters, I feel like that's also just kind of a testament to the whole, reality of epigenetics. Like, there's just so much that go outside of genetics that can activate, whether it's positively or negatively, potentials for things to develop. And I think a lot of people who have been struggling with a chronic health condition, if they haven't found the answers or the tools they've been trying to use to get themselves to a better place aren't working, I think in the positive, most positive sense, it makes you much more open-minded to these types of things, right? It'll eventually start to make you very open to thinking about, like, what if this is something that could be solved in a different way? Of course, like we've been talking about, not so much the pharmaceutical solutions, and people who are subscribed to this podcast are looking more for holistic solutions anyhow, but I think it'll eventually start to beg those questions of, like, what are some deeper root cause things or imbalances I could start to address? And I think this gets into this territory of plant-based medicine as having physical impacts on the physical body, as well as the capacity to alter the psyche and consciousness, right? Both of which are often core pieces to complex chronic health issues. And so, to that end, what I'd love to hear you talk about is the endocannabinoid system with regards to cannabis, because I think that we've heard that term, that's a pretty big buzzword. And I don't know that everybody listening to this is going to understand what that is. And then from there, like, how cannabis can be beneficial to helping modulate the endocannabinoid system in the body.
Absolutely. And that's a great place to start because, as you so eloquently stated, it is a buzzword. It does exist, but 90% of the population has never heard of it. And it's intriguing when patients come to my office, particularly parents that bring their children for evaluation and treatment, and they're still reluctant and resistant. Not all parents are coming in saying, "Oh yeah, great, let's get my son started on marijuana." Um, even though we don't use that terminology in our office, we always call it by what it is, medical cannabis, and we're very professional in how we speak and talk about things, and so when they come in and I see the apprehension and they're questioning the consent form and they're questioning everything, I'll turn to the parent and I'll say, are you aware that you're producing cannabis right now in your body? And they're like, absolutely not. And I'm like, well, you're wrong. And so I start with that. And so I disarm them immediately. And we've got posters in the office that are educational. And so I'll stand up and I'll stand next to one of the posters and I'll explain the endocannabinoid system and how we all produce cannabinoids in our body. And, the first endocannabinoid that was discovered and the name and where the name came from, which is anandamide, discovered in 1992 and named in 1992 by the gentleman that wrote the foreword to my first book, Hope and Healing, the Case for Cannabis, Professor Lumir Hanush. And he called the first endocannabinoid anandamide, which came from the Sanskrit word ananda, which means bliss.
Mm.
So that being said, I start with that and then go into the other endocannabinoids and how those receptors work and how things are found, how these cannabinoid receptors are found all over the body, and which ones are found where, and how they interact with other parts and other receptors. And so now they're looking at it and going, okay, so there is some science behind this. It's not about my son or daughter getting high.
Hmm.
And so now I've got their attention. And so we go through the whole process and everything. But many of these children have already been given very strong medications that are much more addictive than cannabis is or will ever be. You know,
Mhm.
they've come in with a diagnosis of ADD, ADHD, and they've been given amphetamines. And so when mom or dad are giving me grief about that, I'll turn to them and say, "Did you give your pediatrician this much crap when they gave you a highly addictive drug?" And then
Mhm.
I show them a schematic that I have that shows the tiers and the propensity and probability of addiction. And, cannabis is down here, and, amphetamines and narcotics are up here. And I'm like, there there's something wrong here. And then all of a
Mhm.
sudden they see that and they're like, wow, I was not aware. I said, exactly. 1 in 10 people have the possibility of becoming addicted, and not physically addicted but psychologically addicted to cannabis. Great. 90% have a probability of becoming addicted to an amphetamine and an opiate. Are you kidding me? But you're not questioning that, and you're jumping my case. You're giving me crap about a measly 10%? Like, really?
Right, right. Yeah, and it just goes to show how kind of conditioned we are, right? Just from the messaging around us. And your story is making me think about, I think the first person I heard speak, and this is a different example, but Dr. Kelly Brogan, who's a holistic psychiatrist, has spoken at length and written at length about how addictive SSRI medications are, right?
Mhm.
And those are doled out like candy nowadays. And the longer you're on those drugs, the harder it is if you wish to try to wean off whether you have a serotonin, reuptake deficiency or not, right? Like that's some serious stuff and people aren't necessarily told this. And I think this is kind of where the whole reversal in thinking has to happen where you really have to kind of enter all of these situations with a very open mind, like a beginner's mind, like approach it as if like teach me, I know nothing, right? Just
Exactly, but everyone, has a personal doctor called Dr. Google, and
right.
they'll go to Dr. Google and whatever Dr. Google says, and now the new buzzword is Chat GPT. I
Yeah.
mean, if I had a dime now for every person that walks into my office that quotes Doc MJ, Doc, quotes Google or Chat GPT, it's hilarious.
Yeah.
Um, Now I'm not gonna crap all over Chat GPT, because have had other people that have asked, you know, give me the name of a medical cannabis doctor near me, and my name pops up. So I'm not
Oh,
gonna
nice.
complain.
So it's doing something right there,
Yeah,
right?
and on a few, and somebody, one or two people, if I'm not mistaken, but I know for certain one was doing a report for school, and it was on medical cannabis, and they used Chat GPT, and when they were researching, they quoted excerpts of my book.
Oh,
So
wow.
I'm certainly not going to say anything negative about ChatGPT. So if anybody's listening to me, ChatGPT, I love you.
Yeah, and I mean, in reality, these tools are indispensable. I mean, full disclosure, I use it all the time to help me in my work. It's so fast at helping you write stuff, right? But it's like any great invention, you have to kind of hold it in the context of the dark side too. And I mean, we could almost apply that to anything in life. And
Right.
so,
Even
yeah.
medicine, even cannabis, even ketamine,
Yes.
as good as these medicines are, and as good as opiates are. I mean, God forbid, um, unfortunately, I can't take many opiates because I'm allergic to them,
Oh,
to a great number of them.
yeah.
But in moments where I needed some extensive pain relief, I was given opiates, and it helped and it worked.
Right.
But then, the hives, showed up, and the itching and the throat swelling and closing off. That's it. I'm
Yeah.
done. I can't use this medicine anymore.
Yeah.
But did it serve a purpose? Does it serve a purpose? Absolutely. In moderation, as with everything else.
Yeah, absolutely. With the effects of cannabis in cases of, say, like cancer, or I've even done research too on its utility in autoimmune disease, right? Like,
Hmm.
I'd love to hear you talk a little bit about specifically how the endocannabinoid system impacts. From my understanding, there's a great impact on immune system function, but also the nervous system. Am I right with that, Joseph?
Absolutely. We have cannabinoid receptors, as I mentioned earlier, all over our body, from the top of our head to the bottom of our feet and from our skin inward. So we have receptors everywhere, on in our nervous system, in our digestive system, etc. And so when we are having, say, autoimmune conditions, and I have a large number of autoimmune patients from rheumatoid arthritis, multiple sclerosis, um, Crohn's disease, which goes hand in hand kind of with IBS, IBD.
Mhm.
And in fact, in 2 months, I'm going to be speaking to the OSTEMITs, the Ostomy Association for the
Oh,
United States here in Orlando, Florida. So if any of your listeners have ostomies and are going to be present at the event here in Orlando in August 14th through the 16th, I'll be speaking Saturday morning on the use of medical cannabis for the management of individuals that have had ostomies.
oh, wow.
And one of the key things is, the issue with the phantom pain that they have or experience,
Yeah.
but also the post-traumatic stress disorder that is associated and affiliated with a lot of the IBS, IBD, Crohn's,
Mhm.
that people will continue to go to physicians and complain about these symptoms. And because a lot of times there's no real lab test per se, um,
Mhm.
through the years they have been able to find celiac diseases, lab tests and lab work that can be done to evaluate and find these things, and
Mhm.
the autoimmune panels that exist. But a lot of physicians don't think about those zebras. They're always thinking about the horses. In medical school they always teach us, if you hear hoofbeats, think horses, not zebras.
Mhm.
But there's times where you have to go to the zebra and and
Mhm.
and go outside the box.
Mhm.
And because for years, many people have these symptoms, but no real diagnoses, they're frustrated with the medical system because it's shortchanged them. It's not treated them fairly or respectfully. And so for that reason, and that's where the cannabinoids and the different cannabinoids, but not only the cannabinoids, the terpenes, the substances that give the smell and taste to the plant. And it's not only specific to cannabis, all plants have terpenes. So
Mhm.
oregano, rosemary, thyme, cinnamon, sweet basil, all these substances have these terpenes. Pinene, pine needles have
Mhm.
pinene, and each one has a medicinal purpose in conjunction with the phytocannabinoids. Now you have a complete medicine that's helpful with inflammation, that's helpful with anxiety, that's helpful with depression.
Mhm.
Imagine a substance that THC that has been villainized. I always say, if cannabis were a cowboy movie, THC would be the cowboy dressed in black and CBD would be the cowboy dressed in white, because
Yeah.
everybody loves and praises CBD
Yeah.
because it doesn't cause euphoria per se. And they want to just villainize and criminalize THC. Well, lo and behold, THC is 20 times more powerful than aspirin as an anti-inflammatory, and
Oh,
twice as powerful as hydrocortisone, a steroid, as an anti-inflammatory,
wow.
with zero side effects. Because if you take an excess amount of an anti-inflammatory, over-the-counter anti-inflammatory, it's going to affect what? Your gut. You can
Yeah.
end up with ulcers,
Exactly.
or if you give somebody too many steroids or too much of a steroid, you have a host of other issues that can happen. But you
Exactly.
give somebody a plant that has the same benefit or a better benefit with no side effects, and now all of a sudden, oh no, that's going to make me high. No, you're going to be medicated. You're not going to be incapacitated. If we do things responsibly and respectfully of our bodies, it's not going to be an issue.
Yeah, yeah. And I'm wondering, as you say all that, would it be valid to think of cannabis in the same way as, like, say, an adaptogenic herb? Like, it has the ability to kind of go in and balance out what's deficient and calm down what's excessive. And when you talk about steroids, like, one of the biggest drawbacks, especially for people who have autoimmune disease, is the immune dampening like effects that come with it. So
Mhm.
now you're trying to control the symptoms, but you're opening up greater risk of things like cancer, right? Which you don't want. Nobody wants that, right?
Exactly, precisely. Plus all the other diseases, the Cushing's, you could end up with a
Yes.
Cushing's disease, and iatrogenic Cushing's. You get the buffalo hump, you get the moon face because it's an excess of steroids in your body. It throws off the balance. And so the whole purpose of the endocannabinoid system is to have homeostasis, to have balance, to maintain balance in our bodies, that everything is working the way it's supposed to work. And
Mm.
so when you utilize a plant like cannabis, that has all these different substances, you get what's called the entourage effect, which is kind of like a symphony. I went to a concert a few weeks ago, and it was they were playing, it was Tchaikovsky's Fourth Symphony, and I'm listening, and all the instruments started together, and then all of a sudden, the percussion section had a solo. But then all of the other instruments then came in. Then the woodwind section had a solo, but then all the other instruments. And it's the same thing. At times you may need a little more CBD, or you may need some THC, or you may need some CBG, or you may need CBN. You know,
Mhm.
and when each one of those are needed, they'll show up, they'll do their job, and then they'll come back and go back to that balance, like you just mentioned, that adaptogenic, mode of action. Also, something intriguing about cannabis is that it has what's called a biphasic effect, meaning that at a low dose, it has one effect, but at a higher dose, it has a completely different effect. For
Oh.
example, in sexual health, in men, if a male uses cannabis at a low dose, it will stimulate and increase his libido.
Oh.
But at a higher dose, it has the opposite effect. It decreases the libido and causes a little bit of embarrassment in the bedroom. And so, for that reason, you have to be mindful of how you're dosing yourself and how you're using the medication.
Yeah, that's so fascinating you say that. And I know that it's a little bit wider known that, like, it kind of jokingly said too that, like, men that are classic potheads, right? Like, it's like natural birth control, right? I would never take that to the bank though, right? Like, I mean, obviously still want to be careful, like engage responsibly, but it is kind of a running joke, right? Like, it's known for
Yeah.
that, right? At kind of the actual, like, generating a high dose and then chronically used. But it's so fascinating you say that, because I'm even thinking about just conversations I've had on medicinal mushrooms and how there's value in both micro dosing those as well as using them at a bigger macro dose for very different purposes, and they each have their place, right?
Exactly, exactly. And for example, 2 weekends ago, I spoke in Orlando at the Florida Medical Cannabis Conference and Expo that I've been speaking at since 2017. And the topic was From Darkness to Light, how one patient experienced, you know, positive benefits with their traumatic brain injury and mental behavior health issues with cannabis and ketamine. Well, right before I went on stage, the medical director for one of the dispensaries, who's a personal friend of mine, he's an anesthesiologist. And so
Mhm.
when I walked in, to just get a feel of the room and chit chat with him because he was going to be in the audience and I thought he was going to be the moderator. So, and I hadn't seen him in a while and we're good buddies. Um, we started talking and immediately, oh my God, I'm so glad you're talking about this topic. This is amazing, blah, blah, blah. And he's like, remind me, how you're dosing it and how you're using it. So I gave him like my protocol and, my sources and my references, etc. And then when I told him how I was using it, which is zero point 0.5 milligram per kilogram of body weight. So I'm giving half a milligram per kilo of your body weight. So if
Yeah.
somebody weighs 150 pounds, let's put this into perspective.
Yeah.
Somebody weighs 150 pounds, that's 70 kilos. Their starting dose is going to be 35 milligrams. Okay?
Okay.
And that's to start and manage, post-traumatic stress disorder, suicidal ideations, treatment-resistant depression, etc.
Okay.
And he started laughing. I'm like, why are you laughing? And he said, because my dose to put somebody to sleep using ketamine is 10 times that. And I'm like, what? And he's like, yeah. He's like, so if anybody wants to give you crap about how you dose people, send them my way. I'm like, but again, you see the complete difference. At half a milligram per kilo, I'm addressing their brain, rewiring their brain, causing the stimulation of new brain cells to be formed because of the neuroplasticity that occurs as a result of using the ketamine. And to put somebody to sleep to be able to do a surgical procedure, it's 10 times that amount. So the difference between a low dose and a high dose.
Yeah. Are you struggling with chronic diarrhea or constipation and have been told by your doctor that there's either nothing wrong or that you're going to need to take a med for the rest of your life to control symptoms? What if there was another way, a way that empowered you to take back your health through a smart nutritional strategy and through running the right testing to identify true root causes? If you are ready to say yes to self empowerment and to starting the journey to real improvement in your gut health, click the link to grab my free e guide.
Yeah, absolutely. No, I think that just kind of illustrates how it's all in context, right? And we're kind of talking about ketamine now, so maybe we can go there, Joseph, right? Like, I have actually had experience with it, and I have found it to be very beneficial as an adjunct. Now, I do think the disclaimer on this is that it's not meant as a band-aid. You can't go into it with this idea of, I'm just going to go off an SSRI and just jump to ketamine, right? And with the understanding that it's not going to be like you use it once and then you come out of it completely healed and the sun is shining, right? Like, I think there has to be this understanding that it's going to support, like you said, neuroplasticity. It's going to support that like inner shift in mental state, the ability to bring in new perspective, right? And I think really where it's most powerful is used alongside like other trauma healing therapies or just general like therapy in general. Like, would you agree with that kind of with the ketamine example?
Absolutely. This weekend I started a patient that, his mom was at her wit's end. He is morbidly obese. He weighs 310 pounds. He's unemployed. He's been unemployed for a while. He's been very depressed, very anxious. He has a significant other. They have a child together. The whole idea of not being able to provide and support his family as he was raised, to believe he's of an ethnic descent. And so all these stories that he has in his mind of what a man should be and what a man should
Mm,
do, you know, it's has been disheartening for him. And I only know him through the clinic. Obviously, I don't know him personally. I know his mom because his mom is one of my patients. And
mhm.
so we started him, at the office and we went through the whole process and I have them do questionnaires and I investigate and I spend a lot of quality time before we get started on this journey.
Yeah.
Well, we go ahead, do the first treatment. He comes out, of his session and, he looks at my medical assistant and says, I didn't see anything. And she's like, well, you don't necessarily need to see anything.
Mhm.
We were checking up on you and we noticed that you were well rested, you were sleeping. At some points, you were kind of like, in a fetal position, just deep in sleep.
Mhm.
He left not thinking that he had gotten much of anything. That
Mhm.
was fine because that's not my gauge. My gauge is the questionnaires to see how they progress.
Yeah.
Well, The next day, um, he went back home, took a nap, slept for like 3.5 hours, something he rarely does, got up, had dinner, made dessert for the whole family, something that he rarely does,
Yeah.
went back to sleep, slept all night, uninterrupted, woke up, a service uh, person for their air conditioning unit, which in Florida is a necessity, it's not a luxury,
Yeah.
came to their home, and he noticed that this service person was less than pleasant. And so he's talking to him, and his mom is in the room listening, and he turns to this individual who he just met and said, "You know what? You're a little nasty. You're kind of mean. I'm going to give you my doctor's contact information because I think you would benefit from ketamine treatments." And which is completely atypical for him, according to his mom, because he's very quiet. He's an introvert. He's not that confrontational to say or make comments like that. And so the service rep looked at him and said, "What do you mean? What is that?" He gave this individual my entire lecture that I give my patients on how it works and why it works and how the whole thing, like from memory, didn't, no notes, no nothing. And then when he got done, he's like, "I did a treatment yesterday and I feel amazing today. And I haven't felt this good in a long time. So you may want to consider this." Now, you know, does he still have depression? Probably. Does he still have PTSD? Definitely.
Yeah.
But just one treatment was enough for him to refer a patient to me simply because how he felt in the first 24 hours of having been exposed and had received this treatment.
Yeah. Yeah, I would agree with that same experience. In my experience, it's like it almost feels like kind of this weight or this darkness is lifted, right? If that's something you've been experiencing. I mean, I can say that, it to me becomes a very compelling tool if you've been in a place where you feel like all of these circumstances are piling up and you're normally a pretty resilient problem solving
Mhm.
solution person, right? Like, and it's just kind of like you're in a pit and you can't get out. I think ketamine is probably one of the most useful tools to just kind of get that impact in there and get that person to kind of experience enough of a shift. And it's interesting that you said his experience too didn't necessarily include lots of visions or visuals. That was
Yeah.
sort of what my experience was. Like it wasn't like being that this was like my first technical psychedelic experience, I was a little bit nervous going. I'm like, what is going to happen in this session? I have no idea. But I actually found all of the different courses of the ketamine I did to be quite pleasant. Like it's very, it definitely is gonna you're gonna wake up groggy and you're gonna feel like you had a bit of a nap or like you
Hmm.
were, in a semi-sleep state almost is how I would describe it. But compared to what my brain was worried about, right? Like it was not like that at all, Joseph. So
No, and that's why, a lot of the patients that when they come in, because of that anxiety and fear of the unknown, and again, researching on Dr. Google and
yeah,
ChatGPT,
yeah,
the information that you're going to get is not going to be 100%. Or you go to Reddit and
yeah,
read what's on there, you don't know.
yeah.
And so for that reason, I encourage the patients to take some of their cannabis, before they leave their home, use their vape pen, do a pre-roll, eat an edible, you know, something that's going to take the edge off. So when
Hmm.
they come in, they're more in a relaxed state. And again, we start like everything else. We start low, we go slow, and we titrate based on the individual's response and reaction to the medication. And so but a lot of my patients that have been on SSRIs that you mentioned earlier or mood stabilizers, the word that they like to use is that they've been muted. They've been
Yes.
like on mute
Yeah.
for all these years. And then all of a sudden, once they start in with the ketamine treatment, it's as if they're now hearing for the first time and they're seeing, and so like their senses are more heightened and they're more aware of what's
Hmm.
happening, in part because when people suffer from long-term chronic depression, chronic post-traumatic stress disorders, etc., they are shedding brain cells. They're losing brain mass, brain matter. And so by incorporating the ketamine, that causes the formation of new cells and new connections, new synapses. Now they're in a place where they're more receptive, which is why counseling is so um, beneficial to individuals that are going through ketamine, because now they're in a place where they can learn these skills and strategies. And now you've got a multifactorial approach. You've got the ketamine creating new brain cells, but now you've got the counseling that, had they been going to counseling before, they would hear it. It would be going in one ear, out the other, because they can't grasp it because they're in that funk. They're muted. But now
Yeah.
they're awake, and now they're like, oh, that's an interesting concept. Let me try that. Oh, that's it. Journaling? Yeah, let me journal. You know, keep a
Yeah.
diary? Oh, yeah, let me do that. But you've told them that for years, and they're like, nah, that doesn't work. That's a bunch of crap. Now all of a sudden, it's like you can't shut them down. You can't stop them from writing.
Yeah. Well, and I'd love to hear your thoughts on this because I think even the most proactive of people who are, let's say they're doing a visualization, some sort of meditation every day, they're literally really trying to exercise their brain in ways to, in the words of Joe Dispenza, like create a new body from a new mind, right? Like they're trying to actually elevate and rewire those pathways that have probably been maladapted all the way back to childhood, like so many of us, right? Like a lot of these programs get installed at an early age. We don't grow up in the most supportive environments, unfortunately. Would you say that ketamine has a greater capacity to help the average person in that state get into the subconscious brain at a deeper level and really kind of like surface that stuff? Because I think the biggest limiting factor is in a conscious state of mind, people are pretty good at, doing the journaling and maybe watching the thoughts, but then they leave that state of practice and they go about their day, and now the subconscious is driving the bus, right? And that's
Right.
where a lot of us, I think, struggle to make lasting change because what is it said, like upwards of 95% of everything we do is driven by the subconscious brain? Is that right, like
Well,
statistically?
not only that, there's another concept you mentioned earlier, epigenetics, but
Yeah.
intergenerational trauma is a real thing,
Yes.
where studies have shown that 3 to 4 generations, from your, let's say, great grandfather, grandfather, father, and then your offspring, you know up to that 4 generations later, you can be carrying your great grandfather's story, because of the cellular memory that goes on. So imagine, in a Holocaust victim, someone that was a victim of the Holocaust, what their children, grandchildren, great grandchildren are carrying in their cells.
Mhm.
Same thing with, an African American, that great grandfather was, you know, part of the slavery, and father, not only hearing the stories, but also what they lived and what they internalized and what they had to mute themselves and swallow, and, be humbled to feel and experience throughout all those years. Now you're looking at this generation going, what the hell's going on? And
Yeah.
so it truly is a game changer to be able to not only address what's happening now, but what possibly happened, 2, 3, 4 generations before you even came to this plane.
Oh, that's amazing. So what you're saying is the research on ketamine is showing that it has the capacity to help people almost like rewire at that cellular memory level. Is that right?
There's studies that are moving in that direction. The study that I quote a lot was the rat study that was done, to prove the intergenerational trauma, where
Yeah.
they took 20 male rats and negatively stimulated them. So it was the reverse conditioning that Pavlov did. Ring the bell, feed, ring the bell, feed, and then notice the salivation. This
Yeah.
was negative, where they would have them smell a cherry blossom and then give them an electrical shock.
Ah.
Smell a cherry blossom, negative shock. That created a negative experience, causing increased blood pressure, increased heart rate, hairs to stand on end, shivering, And so they knew that they had caused enough of a trauma to make them stressed.
I
Then
gotcha.
those rats procreated and they took the male offspring, had them smell the cherry blossoms, no negative stimulation, and they responded and reacted like their fathers.
Interesting.
Then they procreated and their children reacted like their fathers and grandfathers. They procreated and those offspring acted like their father, grandfather, and great grandfather. And so that's where they discovered and proved that intergenerational hypothesis that there is cellular memory that is carried on three, four generations down the line.
Yeah, and I've actually heard something to that effect. So yeah, that's so great you bring that up because I think that's almost always a piece of chronic health issues too, and that can be a hard piece to sometimes get to the bottom of because often the person who's pursuing the holistic approach might be the one who's meant to on a spiritual level like finally break that chain. So, if your family of origin doesn't necessarily embrace that same perspective, or maybe just they aren't at that place of readiness to kind of do that deep inner look, or think outside the box and try to attack some of these angles of how do I correct this, how do I bring back into balance this disruption in the system that came from an original emotional harm, right, that created this energy distortion. You won't always know what that original story is, but of course the body does, right? Like it lives inside energetically.
Right. And it's, you know, you mentioned Joe Dispenza, it's all energy.
It is.
It's all about energy.
Yeah. Yeah. So true. So true. So, what I want to ask you is particular to ketamine, but I'd like to hear you speak on the cannabis angle for this as well. Do you feel like there is any downside, particularly with ketamine, if someone does have benefit, if they choose to continue to do sessions like long term into the future? Is there a downside to it?
Like with everything, and as we mentioned, there is the propensity and possibility of creating a psychological dependence because ketamine, like cannabis, does not cause a physiological dependence. It
Yeah.
doesn't cause that physiological addiction,
Mhm.
but you can become addicted to the feelings that come
Mm,
along with the sensation, that euphoria, the dissociation. Who am I going to see today? That type of a mentality. And
yeah.
so if somebody has a strong history of addiction, cannabis and ketamine both, there are studies where they have used both of those substances to treat addictions, whether it's opiate use disorder, cocaine use disorder, alcohol use disorder, etc. Those substances have been used for those purposes.
Hmm.
But like with everything else, you know, you have to be mindful and monitor it. Um, I personally um, did my protocol, which is twice a week for 3 weeks.
Hmm.
But then after that, then I started spacing myself out. So I then went to do it every month because I know what I feel like and have felt like since I started the sessions and
Hmm.
how my life has changed and evolved and things that I've accomplished. And so, but life happens, you know, things happen. I'm a physician. I have multiple businesses. I have thousands of people that rely on me for their health.
Hmm.
But, you know, if I have an employee that's having an issue with another employee, or I have a challenge with, my CEO, who we're very good friends, but on occasion, his position and my position may not be the same, and we may have a bit of an upset. How does that carry over? Or I may have an upset with one of my kids or my significant other. And so, depending on what's happening, sorry, you may need a booster, you may need a touch up,
Hmm.
So, for that reason, I spaced myself,
Yeah.
once a month, then every other month, and every 3 months. And I found that at a quarterly basis, every 3 to 4 months, if I do a booster, it kind of erases and resolves any challenges or issues that I may have had. There may be times where I may not need it for 6 months,
Yeah.
but there may be times where I need it sooner.
Yeah.
Again, it's all dependent on what is going on in our lives and how we respond and react. The benefit of doing these therapies is that it gives you the tools and the understanding that it doesn't get you as pissed off as you once did. Things
Yeah.
don't set you off like they did. Those buttons that you were susceptible to, you're not as susceptible to them. So you're more resistant and more resilient to have to, go back to who you were before. But there may come a time where you may need a rebooting. And so at that moment, you just do another treatment under supervision, and then you're good for next, 2, 3, 4, 5, 6 months. I spoke with somebody today that did some therapy, did some sessions, and he was good for a year. And then a year later, he started noticing that life wasn't working for him like it had been before. And
Mhm.
his wife told him, you may want to consider going back to that doctor and consider, you know, possibly starting over again or doing something. And
Yeah.
so he contacted his provider, and the provider's like, I was expecting you to call me a few months ago, but the fact that you called me now is great.
Yeah.
Come back in. So just like you see a dentist every 6 months,
Mhm.
you know, women get mammograms periodically, they get
Yeah.
pelvic exams periodically, they get pap smears done periodically. Why not get a ketamine treatment periodically just to maintain what you've gained so that you don't go back?
Yeah, so that's interesting. And yeah, I think that makes perfect sense. I mean, it sounds like there's a pretty good degree of shift even from doing a round of therapy with it, but life happens and like we're all human, you know. I mean, to say that we're going to be insulated from all of the stressors. And I think the truth of it is some of that early wiring that we all got. I mean, it's powerful and that could be a lifelong process of trying to overcome and basically rewire the brain in a different direction. And I could even see it being useful as like, you know, for myself personally, like one of my personal goals, we spoke of Joe Dispenza a little bit, would be to do one of his retreats in a year, right? And
Mhm.
how great would that be to maybe pair ketamine side by side with prepping for that for a few months just to augment that process of, you know, try to get the brain in a more prepared state and making some bigger shifts to have the best experience possible. Like I think people can even think in terms of like context of where do they want to go in their life and how could they use these different tools to leverage them in short periods of time even to get them a little bit further, right?
Yeah. The challenge is that as a society, we are very judgmental.
Yeah.
And so if we tell somebody, oh well, or somebody says, I think I need more treatment or I think I need more sessions, you
Yeah.
know, the instinct is, oh no, you're just an addict or no, you're just using this as a crutch.
Right.
Well, do you know what that person's story is? You know, I work with a lot of veterans. I work with a lot of first responders. I'm an ex first responder. I was an EMT paramedic in the 80s
Yeah.
where we didn't have all these modalities that we have now. And SSRIs were just coming on the scene in the mid 80s. So that we really didn't have much. So how did we resolve our traumas when we were done with our 24-hour shifts or our 48-hour shifts or our 36-hour shifts? We'd meet at the bar and
Yeah.
we drink silly. We drink ourselves silly. And that's how we sat there, we drank, we made light of it, we had dark humor, and people that were around us would kind of move away from us because they're like, these guys are nuts. But that was the way we dealt with it. Now imagine you've got a veteran that was driving his Humvee with his team, and they go over one of these, implantable devices that goes off. Everybody that's with him dies. He's in a coma for 6 months, comes to, doesn't know who he is, doesn't know where he is, doesn't know his name. So we know he's got a massive traumatic brain injury. Then, when he comes to some realization, he understands that everybody in his crew is dead. Now he's got survivor's guilt.
Mhm.
Why them? Why not me? Why did I survive? Why didn't they? And now, and everything else that is being bombarded, plus all the baggage that he had prior to that, you're
Mhm.
going to tell me that that person doesn't need constant and continuous care and treatment? Come on.
I know. I know. And it's all relative. Like when I think about the number of people addicted to their phones nowadays, or video games, or sugar, we don't judge those with the same harsh eye. But the truth of the matter is, like, an addiction is an addiction. And I think
Mhm.
in the context of, someone who's using something to right themselves, to genuinely try to get to a better place, I would say far better to reach for something that's plant-based, right? Plant-based medicine versus going to the bar and drinking away their worries. Like, I just don't see a lot of positive that can come from that, even though socially it's endorsed. People who are on that same level energetically are happy to go commiserate with that person if they're there too, right? But it's not going to elevate any of us to a better human condition doing that, in my opinion, right?
Oh no, I mean, and Wednesday back in the day, Wednesday nights was nickel beer night for first responders. So we went in. I mean, we didn't even have to show our IDs or our badges. They already knew us by name.
You're in trouble then, right? Like I think back to the dollar pitcher of beer days when I was in college. It's like I don't even know if you could get that anymore.
No, not at all. Exactly. But, so some of your listeners may be thinking, well, wait a minute, cannabis is plant-based and psilocybin magic mushrooms are mycology, they're, but ketamine, that's not a plant. That's a medication. And yes, it is a medication, but like at a low dose under direct supervision, it has remarkable effects. And today I was having a conversation with my intake person, and I was training him on new techniques, new things, new strategies to be able to communicate and convey the message better to our potential clients. And I was explaining to him that the literature shows that 95% of the people that undergo this treatment are cured. And I said, Name something in medicine that cures people." I mean,
Mhm.
yes, chemotherapy can cure somebody of their cancer, but you got to
Mhm.
wait 5 years before you can say, yeah, you're in remission. Yeah, you're cured. It
Yeah.
doesn't happen overnight. But for the literature to come out and verbalize and actually claim that, and the FDA has actually approved the treatment of ketamine for treatment resistant depression, post traumatic stress disorder, and suicidal ideations. So there's some truth to it. And the protocols that we use are Ivy League protocols. It's called the Yale protocol for a reason. That's where they were the ones that did all the studies. I didn't invent this. I'm just plagiarize. I'm not plagiarizing because I always give them credit, but I'm just, I'm riding on their coattails. They came
Yeah.
before me, just
Yeah.
like the pioneers that came before me in the cannabis industry. Raphael
Mhm.
Meshulam, Lumir Hanoush. These men were doing stuff when I was still, in my mother's womb.
Yeah.
The structure for THC was invented in the 60s. I was born in 1962.
Right, 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 right.
So come on, to think that we are reinventing or inventing anything, there may be some new invention, but it's really an improvement on something that already exists.
Yeah, exactly. Exactly. It's not fringe medicine, even though people might see it that way or see it as this new agey thing. And I think not to go too far down this rabbit hole because it's kind of trending in the political direction, but I think one of the real reasons that these medicines or these therapies haven't been totally maybe accepted in the mainstream is because there's not as much monetary gain in it either. I mean, yes, in most cases you're going to have to go pay out of pocket if you want to access these therapies, but you think about the current pharmaceutical medical model. You prescribe one medicine, eventually there's going to be side effects that beget another medical prescription that begets another medical. And like, if you look at which model, if you just give somebody ketamine or cannabis and that's all they need to function at a higher level, there's no hierarchy of more medications to pile on there and make more money for the system, in my opinion, right? Like, I think that's one of the realities of this whole situation.
I'm glad you mentioned that because the first paper that I published once I became a medical cannabis recommending physician was a 45-year-old female that was taking 42 to 58 pills a day.
Yeah.
And her life revolved around her cell phone alarm to
Yeah.
remind her when to take her next set of meds. And yes, exactly what you mentioned. she was on a host of medications, but then she was on another group of medications to offset the side effects of the medications that she was taking for her ailments and her conditions. So at the end of the day, those 42 to 58 pills, a third were for her diagnoses and two-thirds were to offset the side effects of the one-third that she was taking. And
Yeah.
within 3 months, she was down to 3 pills a day. And today, she's only using her medical cannabis.
Yeah, isn't that something? And I think the population is catching on, and more people are savvy to that. And I think that's why a lot of them are doing their own research and starting to elect to kind of opt out of that model, or at least try something different first. And then if they absolutely have to go back to a pharmaceutical model, so be it. But like, I don't think people want band-aided solutions where you're slapping 10 band-aids all on top of each other. And at that rate, how can you tell what's even working if somebody's taking 30 to 40 pills? I mean, that's crazy to me, right?
I mean, what's funny is prior to being a medical doctor, I was a chiropractor.
Yeah, yeah.
And so the example I used to give people when I was a chiropractor was, let's say you're driving your vehicle and all of a sudden your check engine light comes on.
Mhm.
You can address that one of two ways. You can either, one, go contact your mechanic, go to your mechanic, have them evaluate that, or you can get a piece of black tape and put that black tape over that light. You're not seeing the light, so in your mind, oh, it's fixed, but the light
Mhm.
is still on.
Yeah,
It's the same concept. Let me
exactly.
give you something to numb that so that you don't think about it. The issue's there, the problem is there, the root cause is there. You just haven't chosen to evaluate it or look for it. You just put this black piece of tape over it and you've gone on with your life.
Yeah, it's so true. And I think when you look statistically at just prevalence of like once a person gets one autoimmune diagnosis, they're so much likely to get a second and even a
Oh,
third, right? Like,
for sure. Yeah.
right, because like what'll happen, often they'll go get a steroid or some sort of immunomodulating drug, biologic, whatever it is. The body is smart. It's like, oh, you're gonna shut me down in this capacity? All right, then I'm gonna go over here now and create a problem, right? Like it's like I mean, it's not gonna stop. And actually this should be seen as a gift, although nobody looks at it this way. Like people who are truly struggling, I mean, my heart out to you. I understand that struggle, but really, if you look deeper, it's the body trying to get your attention. It's like the body's wisdom saying, like, we got problems here. And the way to handle this is not band-aid it. We want to wake you up and get you aware that like we got to get to the root. Like this is gonna like house on fire. And you can't just put it out by like covering it with a blanket. That's not gonna work. Like,
Yeah. If you take the word disease that we throw out there left and right, and you really look at the word and split it, it's dis-ease, lack of ease. That's
yeah,
what's going on.
yeah,
We
yeah,
chose to name it and give each disease a name, but really the root causes there's lack of ease. There's something not right.
right.
There's
Yeah.
out of balance. There's no homeostasis, what we talked about earlier. And so if you look to what is going to bring me back into balance, more water, more of a plant-based diet,
Mhm.
plant-based medicines, meditation, counseling, there's more than one way to skin a cat, and it's a multifactorial process. You know,
Mhm.
I don't have all the answers. I can't fix everybody, but
Right.
I'm doing my damnedest, and I have a strong team with me that I'm not a counselor by any stretch of the imagination, but I have amazing counselors that they can't give the medication, but they can sure explain the concept and the process. And after I've medicated them 24, 48 hours, they go to them. Now, together we're working to help this person out. And then we get somebody else involved. You're overweight. Okay, let's get you with a nutritionist. Oh, you need to exercise. Let's get you an exercise physiologist. Let's get you a personal trainer. Now we're adding to that. Now you've got an entire team. And,
Mhm.
not to quote somebody that I'm not a fan of, but it truly does take a village.
Yeah, 100%. No, I'm with you. It's got to be an ecosystem. And it sounds like you've really started by creating a space, at least from the therapy angle, where, knowing these things are going to have the capacity to unearth maybe some traumas for people or bring up some feelings they haven't felt in a while. Like to have those counselors on hand is critical, right? But, that's just the jumping off point. And then as that person takes the next step, it's like, what else are we going to tackle? And that's the way it always goes. You have to start with the low hanging fruit, and as the body starts to slowly improve and level up, the energy gets more energy gets freed up to take on more. And it's a process, right? Like none of us by ourselves are going to save the world. That's for sure.
One at a time.
Exactly, exactly. And on that note, why don't you let the audience know how they can connect with you? And if you have any resources you want to share, I'm happy to put those in the show notes as well.
Absolutely. So the easiest and best way to get a hold of me is on my website, which is josephrosadomd.com. So my name, Joseph Rosado, Rosado, MD.com. That's my website. On there, you'll see all the tabs that show all the different services that I provide, blogs, videos, lectures that I've done, etc. But also you'll find the links to the 7 books that I have written, the first one being Hope and Healing, the Case for Cannabis, that was published in March of 2019. I just updated it, and the second edition is scheduled to come out uh, the latter part of the summer, beginning of the fall. So once that happens, we'll be replacing the original edition with the second edition. But then I've also written other books that with the top 5 conditions that people use cannabis in the United States. So cannabis and cancer, cannabis and epilepsy seizures, cannabis and mental behavioral health issues, cannabis and multiple sclerosis, and cannabis and chronic pain.
Mm, very nice. Yeah, no, I didn't even know those top five. So that's awesome. I'll definitely be sure to link all that in the show notes. And I've so enjoyed having you come on. It's not every day you get to have these kinds of like open conversations about things that we've already debunked that it's not fringe medicine. But it's definitely gonna, I think, open some minds and get people very
It's cutting
curious.
edge medicine. I mean,
It is.
granted, cannabis has been in it's been documented that, cannabis was being utilized 5,000 years before Christ. So
Wow.
so yeah, in Asia. So there are hieroglyphics pointing to that, and and then others are going to say, well, ketamine, that was a horse tranquilizer in the 50s. Yeah, it was, but you know what? The vets used it, and then we then decided to use it for humans as anesthesia, and then lo and behold, people that were undergoing surgical procedures were coming back going, hey, I saw this, or I experienced this, or I've experienced this since I had the procedure. And it took some inquisitive minds and scientists to go, what is that? Let's
Yeah.
look at that. Let's
Yeah.
consider this. And then take it to where we're at now.
Yeah. Oh, that's so fascinating. Well, thank you so much for coming on the show. I've so appreciated having this conversation with you.
It was my honor and pleasure. Thank you so much.
You're welcome.
Did you find this episode informative and helpful? I'd love to have you leave me a 5-star rating. Do you have questions about holistic approaches to optimizing gut health that you'd like to ask? Please leave your question or comment below, and I will be sure to address it personally or cover it in a future episode. Be sure to check the show notes for any resources mentioned in today's episode. See you next time.